Okay, so we start with the weather. That's the way we do it. And fall is here. And so this morning, actual thing said fall on me. And yes, fall is here, and we are ready to do this beautiful fall. So weather is fantastic. We are into a new energy, something that has come up, and the colors are blooming. And if you are on Zoom and don't belong to Northwest Arkansas, you are missing something really beautiful that's around the corner. I'm Rani Jung. I'm the director for the Institute for Integrative and Innovative Research. And many of you have heard it before, but I'm going to tell it again to everybody else. We solve wicked problems. We find solutions to wicked problems. And our approach is using a convergence approach to bring different sectors together. And this is perfect. Our speaker today reflects that. And using an integrative, innovative approach so that we can make our solutions to be at scale. I'm gonna, if you can already see the screen, you will see it's an intro to BioDesign and culture process. Let me tell you, if you don't know about the culture process, which you will hear today, I was privileged to be a Wasatch Culture Eminence Scholar in the previous university I was in. But most importantly, those of you who do not know, the Whitaker Foundation played a major role in making biomedical engineering across the whole nation, but across the globe as separate departments. But then Coulter Foundation came in, and basically when Whitaker Foundation was closing down, Coulter Foundation came in, and Coulter Foundation seeded a lot of money and a lot of funding with partnership from different universities to see how can you take technologies out of the labs in the medical space and actually get them out and commercialize and actually make a difference. And they, along with, and you will hear a lot about this today from our speaker later today, but this is really, is to my heart. This is something that is really special. And that BioDesign process and the culture process. So I'm going to stop at that because we're going to have Professor Arman do the introduction to our speaker today. So welcome to this beautiful fall day. Welcome, Professor.
Hello, everyone. Thank you for joining today. I just want to go a little bit brief history of me and Dawood, Mr. Tashayud here. Dawood got her master's. Dawood got his master's degree in Drexel University, and correct me whenever I'm wrong. And then he immediately wanted to start entrepreneurship. He opened a software company with his friend that worked for 10 years. I think 10 years.
25 years.
25 years. I'm approximately. 25 years there, and then he sold his company was sold to Reuters Thompson at that, and then he started his then he became the Coulter manager for several years, and then Drexel University. I'm not going to say how so many years, but after that, after doing the Coulter for several years at Drexel, he started opening his own startups. He started with the FNIR for brain imaging that I think you still have the company is performing and have sold more than 500 systems across the United States and world. And after that, a few years ago, like 2019, we met and we started working together. And I go back to Met earlier. And we had this idea that worked have a full body imager that can be used for medical examiner and for skin cancer detection and classification. So that's something that we've been working. I had the pleasure of working with Dawood for so many years on that, and we had been very productive collaboration with we got SPIRs from NSF and NIH both, and we continue to get that work together on. So that's my professional work with Dawood, but I have to say I know Dawood for 40 years, maybe more. Since we were both in high school, we went to the same high school. We actually sat on the same bench in the last year of high school. And I always remember this kid that was always so eagerly listening to the teacher and following up with such an interest what the teacher was lecturing, while I was just looking at my time to just go out and play with my friends. And then I would ask him what's going on. But so it's a pleasure. So it's a great pleasure to work with a friend, collaborate, and a collaborator and a colleague at the same time. So with a friend, collaborator, colleague, it just it's an honor to introduce you to the.
Thank you. Thank you. As Mehran said, I have had two terms in my professional career, but this has been the most enjoyable part of my career. I work on daily basis with students. We have anywhere between 6 to 10 graduate students working on our joint projects. And some of them are like my kids. I tell them that they're like my kids now. I've been working with them for 3-4 years now. I did not know what to expect here today. So I first did a presentation. I thought I'm going to meet with students. So I tuned it towards students and I made a little presentation about need and finding which is the cornerstone of the BioDesign process. And I actually brought the book so the students can see the book too, and I carried this very heavy book to pass it on to students. But then I found out that we might not have a lot of students, so I added the culture process to it like 10 minutes ago. And then I found out that Ranu was involved with the culture project. And I thought, okay, what are we going to talk about now? I have nothing to talk about. But I'll go through the motions and we can have a discussion because a lot of it could come to discussion. So some people might think of culture process as design thinking. That's another way of thinking about the process of innovation to find out in the locality, in the environment, in the industry that you want to innovate, what are the problems before finding the solution. So a lot of times finding the process of coming up with a medical device is a technology push. So the professor comes up with a new kind of technology and say, okay, how do I apply that to a problem? So you have the technology first and then try to apply to a problem. BioDesign is not that. It's like takes the magical way that you wake up one day and you have this great idea and you make a device. BioDesign replaces all of that magic of idea with a lot of hard work upstream of the process. So Stanford has come up with all the phraseology, and I had the privilege of taking the executive education course, which was like a 4-day course at Stanford, and Josh McElware and Paul Yock, they taught the course. And we visited a lot of the innovation centers around Silicon Valley that they practice BioDesign. The Foundry is an amazing one. If you have an opportunity to go to Silicon Valley, that would be an amazing place to see BioDesign process in action. So this is the aha moment followed by development. This is the traditional way that people think that the medical device innovation happens. The BioDesign takes this aha moment and replaces it with a lot of hard work. A process that at the end of that, you will end up with a device that people want it and it's useful and makes economic sense, and it saves lives. So I messed up my presentation. Looks like I apologize. Um, so basically, it's a process where um, you need to do a lot of work to find out, first of all, what market you're interested in. The market that you're interested in might be because of, I work for Medtronic, and in Medtronic, we do cardiovascular. So that's the area that I need to innovate. I'm in that department. I have to, I am a cardiologist. I understand that. So that's the area that I want to innovate. So you have to select a market and then go through all the steps and I'm going to go through some of those steps with you. And then before you start, you have to look at the economics of that market. As we go along, I have made an example of the technology that me and Mehran are working on. So, and I always explain this to the students. I probably don't need to explain it for you, but there is a total addressable market for each technology that, maybe the market for lighting. There's all kinds of lighting in the world. And then there is a serviceable available market, which is like those having to do with LED technology. And then within that, we see that our core competency is for replacing the LEDs or replacement bulbs. So for us, looking at the market, and our innovation is related to dermatology, is related to finding skin cancers at the earliest possible stage that we can find them. So the total addressable market in this area, let's say there are 16 million people that need to get annual skin checks. So it's like a $6 to $12 billion market. And then the serviceable available market, let's say, because of the reimbursement, because that for all of those people, there is no reimbursement. You cannot just decide to go to your doctor and have your doctor do the kind of technology that we are developing on you and expect the insurance to pay for that. But for the people who have had history of melanoma, that is a reasonable thing. So the serviceable addressable market is $1.1 billion. And we're going after research institutions first. We have installed our first machine at Johns Hopkins Outpatient Center. Our second and third machines are going to Dana-Farber Huntsman Institute. So we are going to install the machine at up to 60 research institutions around the world, and then prove the technology with doctors' offices. We need to at least sell like 20, 30 doctors' offices. And then we have proven the technology that it had efficacy during the clinical trials. And then the doctors did buy it and they made money. And then once you prove the business model, then a company can come to venture. So this is the replacement, the BioDesign replacement for the process. And it all starts with the need. Need is the most important part of this process. There are great engineers everywhere. All the companies have fantastic teams that can implement almost any project. But a lot of them feel like what happens out, like let's say you're inside GE, and they think the reason we're not coming with as many innovations is that we don't have access to that many needs. But I have the best engineering team in the world. If I find out that need, I can make the implementation. So you will see how important it is as I go through my presentation. So the reason many medical devices fail, not technology. There is the technology doesn't work is one reason, but it's not all the reason. And even that reason of the technology not working, that also has to do with need, because you probably picked a need that you didn't have the type of expertise and resources to bring it to the market. So a lot of these go back to the need. No one is willing to pay. That is something that people can figure out with a little bit of work. Graduate students in a week can figure it out without spending $1 billion on developing a new artificial spine component. So you need to know if people are willing to pay for this technology. Not enough patients, you can develop a technology that's good for 5 patients. Centis did that with artificial wrist. They spent $1 billion actually on technology that if they sold it to everyone that could use the technology, they still wouldn't recoup the money they spent on the development. They could have done that on a piece of paper with one graduate student. So this slide also talks about the same thing. As we go along the development, the costs go much higher and higher. So you want to fail the projects early. So we want to fail up. So, okay, this wasn't a good need, let's fail it right now. Or at the concept level, or at the prototype and development level, or at the clinical level. If you fail at the clinical level, this is the cost that you're looking at. Whereas at the need level, if you fail the project, you have spent a lot more time and energy. Look at the years going to a project at the development stage if you want to fail at that stage. A lot of projects can be failed a lot earlier. So a lot of this information is in the book, and I have taken it out of the book. So I'm not giving reference in every slide, but they are all from the book. So needs are not easy. They're really finding that need is very difficult. And you can see that Linus Pauling said to have a good idea, you have to have a lot of ideas. And Henry Ford said, if I ask my customers, what do you need? They say a faster course. So it's very, very difficult to find that need. And it's not obvious. So BioDesign has come up with a process for doing this. And the process is a numbers game. So you have to look at a lot of needs to be able to come up with, a concept that you can take to development and clinical work and that way. How do you come up with that many needs? You have to be in the situation, in the market of the technology area that you want to develop. You want to innovate in the cardiovascular area. You have to camp out in the cardio department, in the hospital, in the ambulance, in the helicopter, while they're transporting the patient, in the operating room, in the recovery, everywhere, and observe for long periods of time. You have to talk with the patient, with the doctor, with the nurse, with the ambulance driver, with all the people that are involved in the process to see what are the issues. And so the process is very time consuming. You have to have a team of people approaching this, a team that has different expertise. They have to have domain expertise. So that's good. But if you go with somebody with domain expertise, they are jaded. They see the solutions that are existing as God-given, and oh, we have the solution for this thing, and And that's not enough. You need to have marketing. The person can understand what sells, what doesn't sell. But you also have people from outside the business. People who look at the problems with the fresh eyes. In Drexel University, we did that. We sent groups of students to shadow the doctors, not interact much with the doctor, but write down what the doctor did during a period of 1 week. And they wrote a report and gave it to the doctor. And the doctor said, really? Is that what I do? And they were surprised of the flaws that the students saw in what they were doing. So you have to have a mixture of people who go out there to find and to get these needs, and they have to find a lot of things, right? You have to have a lot of ideas to come up with a good idea. So there is a specific format I'm going to show you that, I said Stanford came up with a phraseology of how to document the needs and how to select between them. So it's an iterative process. You have to come up with a lot of needs, and during the needs finding, you're not trying to kill the needs. During the needs, you're not trying to find needs, you're trying to kill those needs that are going to be costly for you down the road. So, you're only looking for problems. Every problem that you find should be written down and should be discussed and should be examined to the nth and item before you reject it. But during finding process, you want to write down every problem that you see, every problem that you come across as you observe in a hospital for a month, which is what people typically do. This team of needs finding go out there. Just to tell you a little bit, I was really passionate about this while I was in Drexel University. And Stanford has established BioDesign centers all over the world. And they take basically graduate students and they put them through these programs, they have 6 months program, they go through needs finding, and they go all the way through the process of innovation. And they learn a lot of them are medical students and so forth. But there also exists a big group of people in the industry, like, let's say at J&J. That was a specific group that I worked with while I was at Drexel. They wanted to come and do needs finding in Drexel's hospital. That sounds like something reasonable to do. In practice, it's close to impossible for them to come to the hospital and do their needs finding. There are a lot of prohibitions. There are laws against selling to their patients. So it's very, very difficult for a company to send a team, a needs finding team to a hospital to find those needs. When J&J approached me and they wanted to come to Drexel University to do needs finding, send a team, combine their staff, their domain expert, their marketing expert with the students that had the fresh eyes to go and find these needs, it took them 2 months negotiating an agreement for them to come and do needs finding for 1 month. And I thought, okay, this was so painful, they would never want to do it again. They finished it, they wanted to do it again. So that gave me the idea that there are a lot of companies that want to do this. And if the university makes it easy and puts together, once you get the agreement developed, that agreement is pretty much can be applied to everyone. Nobody has to go through this 45 2-month day of negotiation again and again. You set up a process where the companies can come and visit and bring their their brass to the university they get familiarized with the students from the university. The students gain the experience, they gain familiarity with the companies, and that process can repeat and they can. I thought that a better approach to BioDesign Center than what Stanford is doing, which is putting all the students through, is to bring in the companies to the university and set up BioDesign centers where companies are members of that BioDesign Center. And they are allowed to pay an annual fee and send BioDesign needs finding teams twice a year maybe. And then all the needs that they don't want go into a needs bank where the student can use those needs and do other kinds of work with it. So I spent good amount of energy, but then I got busy with my companies and I gave up. So this is an example of a need statement, a way to address a problem in a population and then for an outcome. A way of screening skin cancer in over 50 population that can find skin, stage 1 skin cancers. So I want to find skin cancers at the earliest possible stage that I can find it. Now, this statement doesn't look like much, but if you think about it, this is my advertising. This is how I go to FDA. This is my label on my product. This tells me what kind of clinical study I have to do to get this device to FDA. This one sentence here has so much impact on everything that it's worth spending some time to get it right. And getting it wrong is really bad. So it guides the brainstorming, it facilitates concept screening, value screening. Part of the IP, you decide how you file your IP, because it's going to become your product. Clinical trial protocol comes from this, sharpens marketing efforts, basis for the reimbursement argument. All of that comes from that one line. So very, very important line. So you see why need is so important. And regarding the filter process, Coulter wanted to, their vision was, in US, we don't make TVs. We don't make the best cars. We don't make the best TVs. We don't make the best cameras. We make the best medical devices. We are competitive in that area. How do we stay competitive? How do we save lives by becoming more competitive? And how do we improve patient care in the process? So Wallace Coulter, in his lifetime, had seen a lot of adversity. He had traveled the world. He had seen all the misery after the war. And he wanted to do good. So he left $500 million, the proceeds of the sale of the company that he and his brother owned. They sold to Beckman, so Coulter Beckman so as a result. And $500 million went to the Wallace H. Coulter Foundation. And they thought, how do we do good? And they said, okay, we engage with universities. And many universities applied for endowment so they can do the good work that the foundation wanted to do. They selected 10 universities initially and their mission was that, okay, we're going to give a little bit of money every year to these 10 universities and see what kind of translation, what kind of commercialization of life-saving technologies they can achieve with $1 million. So they selected 10 universities. they said, okay, if you do a good job, we give you money for 5 years. And at the end of 5 years, we're going to evaluate it somehow and decide which universities deserve to get an endowment so they can commercialize their medical device technologies forever. So, but nobody knew how they were going to evaluate these universities. Along the way, during those 5 years, we met all the time. So I was the culture program director at Drexel University. There were 10 people equivalent to me. And then there were 10 people who were the heads of the biomedical engineering department. The 20 of us met at least twice a year with Culture Foundation being very hands-on, probably putting the most input into the process. This process of de-risking was developed. And the process, although in most universities was and is technology push, the foundation was very interested in finding the need and then finding technologies that are deserving. But then you have to have a lot of screening. So when a professor, a team of professors would apply for culture funding, we would look not just as the scientific merit of the proposal, but there is a lot of other ingredients that go into a successful proposal. And we had to evaluate all of those. So sort of more rigorous than an NIH, although maybe we were easier to give out money at that, at a worse score, but we look at more attributes of the project. And the people who, then there was a panel, just like the NIH, we had a panel. Our panel didn't change from time to time. It had 3 people from industry. We had always J&J present at the table. We had Integral Life Sciences because they were on the buying spree. They were buying companies like at the rate of 1 a week when they were part of our oversight committee. And also people from medicine, School of Medicine, economic development groups. So we had a panel with different points of view from the financial, from the technology, from business, that would look at the proposals from different eyes. And then their job wouldn't be done once the proposal is funded. Every 6 months, the teams had to come back and explain to the oversight committee what they have achieved, what they're trying to do. They would get advice, sort of not like the NIH that they're hands-free. You get the money at the end of the project. Maybe you give a report, and that's the extent of the involvement. That was not the case. The involvement is constant. From the culture program manager, I have to act like the CEO of the company. I am responsible for taking that technology to the next stage, whether that would be to get it to a strategic company that is going to license it and bring it to the market, or form a new business around it with management and get it to somewhere, or admit that we made a mistake. Otherwise, we have to constantly fund them. So either those commercializers, or we admit mistake, or we have to keep funding it. So I funded 1 year, no commercialization activity happens. I either have to admit I made a mistake, or I have to give them money for the 2nd year. 2nd year ends, I have to give money for the 3rd year. So we don't have a lot of money. The program, I shouldn't say the program could support 3 projects a year. So if I gave my funding to an existing project, that means that I couldn't bring another project in that was deserving. So, so we have to be very selective in the projects that come in, because you have to think at the time they come in, they have to go out. Might be very exciting to bring a interesting science project in, but a mundane science project could be a better commercial project. So that was the selection committee, and the program manager would review and make sure that now, how do we de-risk the project? The de-risking is basically to answer a killer experiment. Like, what is a definitive experiment that can prove to everyone that this technology has merit for the licensee, for the company management that's going to get involved? So it had to be a compelling study design that if you show the data from that, that was compelling enough for the technology to get licensed. So, and that was basically the most important thing that we had to do. And how we ended up being measured, we didn't know this in the beginning of the program. Like a few months before the end of the program, the foundation learned, and we learned at the same time, that the follow-on commercial funding is the only measure of getting the endowment. That is, if we put in money into a project and government puts money in the project, that project still has $0 of commercial follow-on funding. When a GE comes and put $1 in it, that's $1 of follow-on commercial funding. You go get $6 million from NIH, you still have $0. You get $1 from J&J, that's $1. So we put in $5 million into the program. The commercial entities put $20 million into those technologies. So then that is a multiple of 4 to 1 of commercial follow-on funding to Pulsar funding. So most universities were at 10x commercial follow-on funding. So, and I think that was brilliant that Pulsar came up with that measure as a measure of successful commercialization. Because, yeah, like people in Johns Hopkins, they can generate a lot of NIH funding, but that doesn't mean that this is going to be a very good commercial success. The follow-on funding, the people who have to put their own dollar out of their pocket and put it in the project. So 5 universities out of the 10 universities got the endowment. I was lucky enough that Drexel was one of them. One of the technologies that we invested went all the way through FDA while I was during my tenure. I was there actually for 10 years running the program and got its FDA clearance, and it's being sold by Siemens now. Several other technologies were quite successful, but because of our commercial follow-on funding, we were able to bring in the endowment into Drexel as well. I think that's where I'm going to stop. I don't know how we're doing with time, but we can have a discussion. We can have question and answers. I'll be happy to answer your question.
Make a comment that one Pulsar is a Tarkatan, he was born in McGee, Arkansas. And so he actually he's an Arkansas who did there. And the FIU Biomedical Engineering Department was the only department that was the first department that they endowed as a department, not for this thing. So it was a Wallace Pulsar endowed department. And then later Tech got endowed, but Wallace Pulsar went to Georgia. But the FIU department is, and they're right down the street from the.
Yes. one of the 5 universities was Georgia Tech. They got their endowment before any of us. And I don't think they had to pass any tests to get the endowment. So really 4 universities had to pass the test to get the endowment. And I went and visited the beautiful biomedical engineering building that the foundation built for Georgia Tech. And they had the original corporate counter and a display downstairs, which is really good. One story about Wallace is that I think Wallace was in Far East when the war happened, and he wanted to come back to the US, and there was no, I jump on the flight and come back to the US back then. So he had to go on commercial ships from one port to another port. And that's when I told him he saw a lot of misery. He went to Middle East, he went to Africa, he went to South America, long ways back. Then this is, I don't know, maybe like a story, but it's a fun story. So apparently, he and his brother get this contract to make a device for evaluating various pains for the Navy. And they make a machine, they make a corporate counter, was not for hematology in the beginning, but was for pains for US Navy. So he goes to get paints from the garage to put in the machine to measure the constituents of the paint, and paint is dry, it cuts his finger, and then it puts the blood instead in it. And Corporate Counter was born, $1 billion company. So that's a very interesting story.
We do have one question online. Professor Raj Rao from Department of Engineering or from the College of Engineering in biomedical engineering is joining us. And he says, thank you very much for a wonderful presentation. I teach a course called Biomedical Innovations for Global Impact, where we have adapted the BioDesign process. One of the motivations behind the course is to bring together students from different backgrounds and different perspectives to address common needs based on their specific location and constraints. One of the major challenges associated with generating a feasible design that can work across different cultures are the economic constraints. Could you comment on how the BioDesign process can help in the generation of low-cost innovations with potential for broad impact, especially in underserved communities across the world?
Well, I think the answer is sort of in the question. I think it can be very impactful. I met with the person who's now the, I apologize, who runs Medtronic now. And when I met him, he said, in China, we sell exact same devices that we sell in the United States. Less than 1% of the people buy it. We have sourced devices from local companies. We have bought local companies in China for cardiovascular application. And, maybe another 10% of the population can buy those devices. But then you have these masses of people in Africa, in India, all over the world that cannot afford the same device that the insurance pays for in the United States. And a big way that universities and students can contribute is to come up with innovative solutions for those kinds of problems. And I think that's very valuable. It also reminds me of a program that Professor Kiani in Temple University runs. I think all engineers without borders, something to that effect. And the student teams go to, resource poor countries. They can get big donations of devices from US, from Europe, from everywhere, but they have no expertise in maintaining those devices. I'm not talking about repairing them. just keeping them in working conditions. And these student teams go and there are warehouses of devices that come out of the hospitals in the United States, and they can be easily retasked and put back to work and serve those communities. And Dr. Kiani has done a really good project, and maybe he would be a good resource for the person. And they can team up and send students from Arkansas to help with as well. Yes.
Thank you very much.
Great. And I wanted to ask about, see on the slide VCs. And I guess, if you hear VCs talk about what they do in their evaluation, it sounds like it's a similar process.
It is very similar process. And again, our goal wasn't scientific. So our board, our oversight committee is like our board, shouldn't have the same makeup as NIH that's interested in science. So VCs are a big part of it. If we have the people that are eventually have to fund the project, select the project in the upfront process, then that project has much better chance of, at the end of the process, going in front of the same VC and being successful. Because the VC with the same brain, with the same criteria, selected that project as the project that might be. So I think that is a very key part of the.
So it seems you're saying that the VCs are an important part of your team.
Yes,
The culture team.
yes.
Do the VCs see that having
The others on the team, is there value from VCs to sort of partnering with the culture team?
So yes and no. So maybe not so much in Drexel University that I was. Maybe that will change over time. But let's say in Stanford, they fight tooth and nail over culture technologies coming out of the pipeline. It's a pipeline that they know the technologies coming out of it are vetted, are selected properly, have answered that killer study question. So when they come out of the pipeline, they have some merit. They can visit that pipeline again and again and again. So yes, the people who sit on the VC committee know better than anyone else what's in the pipeline. And there is no conflict of interest in them fighting each other to pick it up at the end of the pipeline. So I think it's all good. It's a win-win. Did I answer your question?
yeah,
No, I just, I guess from the culture process standpoint, the VCs are a partner and essentially the innovators are a partner,
Yes.
but the customer is the patient or the.
True, but my dad was also an inventor, and he published everything he invented. How many of them do you think are serving humanity? So there has to be a commercial process, there has to be IP, there has to be funding, there has to be commercial processes happening for a technology to come and serve humanity. So just being idealist and saying, no, there are VCs, they have no room for VCs in academia, then I think that's closing the door to translation. I think the commercial aspects of the technology would dictate whether that saves lives or not the scientific aspects of it. But I think there's one thing that my dad invented that is still in use, and he patented that one, and some company in England stole and never paid him, but it's still in use. Yes.
And so Just a question regarding Coulter. You said it was the $1 billion that they put. How much money they?
So the proceeds from the sale of the company was $1 billion. Half of it was Wallace's, so that was 500 million. And then what they gave to the Princeton University was $1 million a year. And then they dangled a $20 million endowment in front of the university and said, okay, if you are successful and you can commercialize your technology, which is life-saving technologies, we evaluate you at the end of 5 years, at the end of $5 million. And then if you're deserving, we give you $10 million that you can match with $10 million of your own money. So Coulter was like this all the time. They wouldn't just give you money and say, we go have fun with it. They would make sure that you are part of it, you work hard for it. We are partners. They said, we give you $10 million, we match it with $10 million. You can move it from your general endowment into this specific endowment. We don't care, but it should be only used for Coulter purposes. And you put those two together, then you have now $20 million. The interest that you get on that $20 million can support 3 projects every year. So they wanted to have a program that can work forever without them supporting it forever. And they figured $20 million is the size of endowment that can make a small self-sustaining program.
So it was the interest of the money.
Yeah, they never touch the principal. So the principal would grow, and if you don't use it, it will grow more and you can support more projects.
That's the question. It only goes so far.
Yes. So let's say you have access to a pool of money, you can use the Coulter process and get people to move their technologies and be very hard on them. Everybody likes to get money. Every faculty member is interested in, getting more resources for their lab, but then you can use this process to more effectively translate. And it could be everybody. Yes.
Related to this, at the institute itself, it's that I've been influenced, setback. I've been influenced extensively by this whole Coulter process because of the FIU department, which is an endowed department, and spending so much time with them of how things happen. And then NIH has been doing that CDI program, which is the Coulter process. They basically took the Coulter process, and NIH actually has established that. But now at the institute, we have been saying we want societal impact, and we are not necessarily just about medical technologies. It could be other things than medical technologies, and that we will focus on deployment. And so this process kind of helps in that. How do you think we might, with your extensive experience in Drexel as the Coulter, the TPP director, how do you think you might guide us in effectively creating this process for the institute itself? And what could we, amongst us, our faculty who are in the institute, how could we, what would we think?
Well, I think Coulter's intention from beginning was to come up with a process that's replicable. And it wasn't done for one university. It was a process that was tried out in a university like Drexel and a university like Stanford, and there was BU in between, and there were all kinds of universities. And maybe they just picked Drexel University just so they have a spectrum. And we were successful. We were successful where a lot of big name universities were not successful and did not get the endowment. So I think the process has proven itself that it's a workable process. I think Elias Taro consults in this area, and I think that's how he makes a living now. And he would be very happy, and he's as smart a person as you can get to, get you started. I think it's completely reasonable to take the process and apply it to other areas, to have some kind of component that's Arkansas related with local needs and local, technologies that are available to you. And I think it's completely reasonable and completely portable process that you can take from another university and install it here. Do your own tweaks to it, as I said, there could be parts that are Arkansas related. And I think it's a great idea. It's very doable.
How important is it for us to have a very experienced TPP director?
So that was, I might have been probably the least experienced full-time program director in the whole entire program. The reason Drexel reached out to me, they had a different full-time program director when they wrote the application, but pretty much I ran the program for the duration of the 10 years that I was there. And the reason they arrived at me was that I had experience in buying and selling companies. My experience wasn't in agriculture, wasn't in biomedical engineering, but having bought and sold small companies. And that was what was attractive regarding me to the company. They knew me and I was a graduate student over there. And you know Banu?
Yes, I'm fine.
Yes. So Banu was my PhD advisor, but I never finished my PhD. I got employed and left. So Banu brought the Coulter program to Drexel, and Banu is like a sister to me. And she knew that I might have the horse sense, but she also knew that I have bought and sold companies. In other universities, most of the Coulter program directors were part of the C-suite in major companies. So that's what they went for. They went for a member of a C-suite in a major medical device company. I think Stanford went to Kaufman Foundation and they got a fellow out of Kaufman Foundation. And I think that was also a good idea. Or even if the person that you have in mind may do a fellowship in Kaufman Foundation as part of, on-job training. So different strategies. I told you that Drexel's strategy was somebody that has some entrepreneurship. I went to people's houses and introduced buyers and sellers and very hands-on, very put together deals at personal level. And I think that was a good approach for them. That worked out for them. Whereas maybe a C-suite person would be more aloof and less into relationships. So I think there's a lot that goes into thinking about what kind of program director you would need. And maybe for Arkansas, it would be different. You have certain funding sources, and that person might be a person that has had success with dealing with those funding sources. So much goes into thinking about who that person should.
We have to go today. So it's really fantastic.